Hello, my name is Katrina Magwood, and I'm presenting to you today my capstone project for my MSN program with a concentration in Nurse Executive Leadership at Benedictine University. The title of my project is Transitional Care in the ICU and Interprofessional Collaboration, Creating a Standardized Approach to Care Coordination. The purpose of the project is to develop, implement a timeline and future evidence-based and patient-centered safe transitions care program for the adult ICU using case management and the interprofessional team. I will start by giving you an introduction into the capstone project. I identified a gap in the process of interdisciplinary rounding in the ICU. Currently, there is an ICU case manager assigned to the ICU who has a role to meet the goals and needs of the patients and families through the coordination of care involving all disciplines to include physicians, nurses, pharmacists, therapies, and outside resources. However, currently there are no ICU rounds being performed at this time, which creates a breakdown in communication, potential increase in length of stay, and a delayed transfer to the next level of care with the potential for an increased mortality. According to Joint Commission, the lack of effective communication has been cited as the root cause of 70% of major medical complications. The project will improve the collaboration performance of the multidisciplinary team by strengthening communication between the disciplines, decreasing barriers for the transition to the next level of care, which will ultimately decrease the length of stay. A review of literature was completed using Senhall, Medline, and Google Scholar databases, which focused on intensive care words, transitional care, transitions of care, care coordination, length of stay, care management, discharge planning, multidisciplinary rounds, and patient safety. The search was narrowed by using peer-reviewed articles and research studies with the years of 2013 to 2018, using the English language as the research language. Interprofessional collaboration are one of the many approaches to improving healthcare quality and having outcome measures. So the conceptual change for this evidence-based change in practice is the patient care delivery model. The model directly reflects and facilitates the streamline of the care coordination process within the acute care hospital. The framework purpose is to assess, plan, advocate, and evaluate specific role requirements. The PCDM model fits the project because it helps guide the change in the process to optimize the collaboration process. So ICU staff and case management staff are all on board with the change in the process related to communication amongst the disciplines. However, they have a major concern that the contracted pulmonary specialists may be resistant to the process. So that's something that would have to be looked in and followed up on because those pulmonologists are not part of the system. Uh, the financial savings of this, just shaving off one day for each patient would save thousands of dollars. Unfortunately, there may not be money in the budget for this process to be implemented at this time, and education and leadership can play a major role in the implementation and get the staff involved. So the project setting, it's at Piedmont Newton Hospital. The ICU is comprised of a 10-bed unit and 97 beds total within this rural facility. So the hospital is part of a large organization which is consistent of 10 hospitals. The objective is to standardize this interdisciplinary rounding process by improving the communication across the disciplines and improving care coordination by defining the roles and enhancing the multidisciplinary rounding. So the proposed change is to improve the process by having AM and PM huddles, aka rounding, at a designated staffing area with all disciplines present. The attending hospitalists would discuss their patients and address any needs or barriers to the continuum of care. And the remaining disciplines, once the hospitalists have spoken and talked about their patients, then they would discuss all the other patients and follow up with the physicians as needed. A whiteboard would be utilized with categories of information pertinent to the patients and assist with the improved communication. So there would be a standardized question list that will be used in Huddle to keep track of the time and efficiency and to make sure everything gets done in a timely manner. Um, the This would also foster a culture of collaboration, teamwork, and use all available resources to improve patient outcome and decrease unnecessary resource consumption through early intervention. So fit for proposed change will decrease costs, increase patient and family satisfaction, and improve patient outcome. The stakeholders are the Director of Inpatient Services, Director of Case Management, ICU Manager, ICU Case Manager, and they will have a huge impact on the success of this project. Budget. So the budget is projected to be approved for indirect costs and direct costs, and the staff will require education, which will ultimately bring the budget to approximately 21,000, and that's just a rough estimate. Of course, it's inflated and it could be more, but 21,000 is what I came up with, and that includes all of the training and staffing and materials area to be built out. So the measurement of communication will be measured by using the Press-Ganey patient satisfaction survey in the ICU. The length of stay will be measured using the case management scorecard, and the scorecard is sent out monthly, and numbers which address the length of stay for the hospital. If the length of stay is using DRGs, then this will measure how well the rounding process is being coordinated through the interdisciplinary team for the patients. So the future of the project will fall on the director of the case management. She will implement the project and will require the assistance of the ICU manager and the case manager. The director of inpatient services states that may be able to use the scripted portion of the tool as a tool, but unsure about the whiteboards at this time. So moving forward, the project will be presented to in the quality meeting where the department directors and managers attend as a process improvement project. So honestly, the reflection of the capstone project was a bit stressful and I became very discouraged at times. However, I found myself enjoying the collaboration process. The meetings with the executives and the leaders was amazing experience. This process allowed me to grow as an individual personally and professionally. I unfortunately am not a good networker, but this project allowed me to leave my comfort zone and venture out. So everyone was very pleased and helpful, very pleasant and helpful. And I have to say that the finance part of portion was a bit challenging as I have not dealt with or done the finances professionally. So that was a hump to get over. I was able to speak with the financial analyst who broke it down for me on a level in which I could comprehend. So that was very helpful. My preceptor was nothing short of amazing and provided every resource and tool I needed to be successful in this experience. So I'm very grateful and thankful for that. I am excited about paying it forward and growing other nurses in leadership in the future. Thank you.